Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. What we're going to talk about today, we're going to talk about anesthesia, but we're going to specifically talk about the anesthesia assistant program at Nova Southeastern University. And let me introduce two pioneers. How about that? Pioneers. First in front of me is Michael Stout. He is an anesthesia assistant, certified anesthesia assistant.
Correct.
Correct? And you're the director of the anesthesiology assistant program here at Nova Southeastern University.
I am. Thank you very much. Nice
Welcome,
to be here.
welcome. And Stephen, or Stefan, however you would like me to do it.
Stephen, thank you.
All right, Stephen Andriadis, a good Greek name, strong name. And you are a PA, certified PA, a physician assistant, and also have a master's program, a master's designation. And you are the clinical director of the physician assistant program here at Nova Southeastern University. Welcome.
I am. Thank you for having me.
Good. Okay, Michael, what's an anesthesia assistant?
Well, that's a great question because it's a profession that not a lot of people know. It's sort of a niche field, and as you mentioned, that a lot of people have questions about anesthesia because it doesn't end up in the media as often as some of the other fields like nursing. Surgeons and other physicians get more media attention. Anesthesiologist assistants are the sort of the PAs in essence for the anesthesiologist. We are anesthetists, so we can assist anesthesiologists in providing anesthesia for patients. We help them deliver the drugs, placing special devices, whether to help you breathe or to monitor you during anesthesia, and generally watching the patient while they sleep. So we have 10 anesthesiologist assistant programs. NSU's got 2 of them. Stephen's with the physician assistant program, which works very well with anesthesiologist assistants in the operating room, but the numbers have been changing. So it started just back in 2006. We only had 4, with NSU being one of them. So we were the 4th and the 5th program in the country. So still representing a good portion of the AA training.
I didn't mean to trip you up, Stephen. I was just, what I was trying to get to was knowing that we were the 4th program in the United States. I believe the Pioneer program was at Emory, if I'm not mistaken.
It was.
Right.
It was.
And the Case Western.
Right after.
Right after. And what happened was the legislature in 2006.
Correct.
The prior legislative session made statutory decisions to establish the anesthesia assistant program as a healthcare program in the state of Florida. So now, you as a PA, your relationship to anesthesia assistant, tell me, what is it?
Well, we work very closely with them in the operating room. Those PAs that choose to do surgery, they can be in any specialty they want, but if they do choose to be in surgery, they will be side by side with the anesthesiologist, waiting for them to get the patient ready, putting them to sleep. And then our role is really prepping the patient and getting their position ready, but we have to communicate the entire time we're doing that with the anesthesiology assistant to make sure that we're not interrupting any of the stuff they've already done. And then our role is to really get the patient ready and then assist in the surgery and help getting them back awake with the anesthesiology assistant as well.
Now, both of these programs are master's level programs, so it isn't just a baccalaureate, it isn't a certificate, they're all master's level programs.
That's correct, yeah.
Right. Yes. And we're so proud of the PA program here at Nova Southeastern. Again, and I give a lot of credit not only to the pioneers here, Dr. Marquardt, but particularly Dr. Rick Davis, who was the dean of now the School of Healthcare Sciences, but at that time the School of Allied Health. We have at Nova Southeastern University 4 nationally accredited PA programs, correct?
Yes, we do.
Where are they?
We have one in Jacksonville, we have one in Orlando, we have one in Fort Myers, and then our one here in Fort Lauderdale.
Right. And the thing that people do not know is that physician assistants, who they come across many times, whether they went to Cleveland Clinic or Mayo Clinic or any of the hospitals, they see physician assistants all the time. But one of the things that has occurred over the last couple of decades particularly is the specialization, almost the fellowships that are involved with PAs. So you might find a PA that is working in the OR with a orthopedic surgeon or a cardiovascular surgeon, but they are specialty people in receiving specialized training, correct?
Correct, and I'm glad you mentioned that because I think, and now PAs are in every single specialty that's out there, and that really has changed over the years. We are trained in family medicine, but what we're finding is that our graduates are really going into just about every specialty. And you know, this is a good month for us. Last week was PA week, so we're really excited about that. And a lot of the patients that are out there don't really know what a PA is, right? And those same patients also, some of them don't know that they were seeing a PA. They realize later on that I didn't know I was seeing a PA, I thought I was seeing a doctor. So really we're extenders, and like I said earlier, we're in every specialty now, and it's very exciting, very versatile. We could be in the urgent care office one day, the next day we could be assisting in removal of a gallbladder, and the next day helping to fix a fractured ankle.
Yeah, and the thing is that, and I just so that the people know, just so we can give them a view of it, physician assistants in the state of Florida work under the protocol, the assigned protocols, with a physician.
Correct. Yeah, we all have a supervising physician, whether we're in the operating room doing surgery with that physician, or we're in the family medicine or urgent care clinic. We always have a supervising physician. We do see our patients on our own, depending on the specialty. We may have more autonomy in other specialties like family medicine, internal medicine. We usually have our own patient load. We prescribe medicine. We treat our patients. We diagnose and do the full spectrum for them.
Let me get back to you, Michael. Let's get back to the anesthesia assistant program. I know there was a lot of, I would say, reticence on the part of the policymakers to allow for an anesthesia assistant program. And I, certainly understand but as we create more tertiary care facilities, large hospitals, or even smaller hospitals, or urgent care centers, or self-standing ERs like we have here on the campus of Nova Southeastern University, you need anesthesia as part of the spectrum of services. And I believe that the policymakers looked forward as they were going through the early 2000s, and saying, how are we going to expand services to the many people in our state unless we have PAs, and to be candid, ARNPs and FNPs, our nurse professionals, as well as anesthesia assistants.
Yeah, absolutely. I'm glad that they did, because there's been lots of studies have been done showing that there is a workforce shortage that we're going to be encountering as the baby boomer generation is needing greater services, as many aging anesthesia providers are going to be exiting the professions. Several of these studies have pointed that we just don't have enough services that can be provided for the public. So bringing more people to the career, more people to the profession provides better opportunity and access for healthcare for the members of our community. As you mentioned, NSU is building a hospital on campus, and it's going to need services. Many other hospitals are expanding as well. There are great anesthesia providers out there today, and I'm proud to announce that in the state of Florida, due to those decisions, we have 315 AAs now licensed in the state of Florida, delivering great care to patients.
Well, we're very proud of it too, and I can only say, a lot of people don't know, and they see in whatever, it's the ARP journals or on television, or they got Yahoo or Google or whatever, and they see all these comments about physician shortage, nurse shortage, pharmacy shortage. It was clear that if you want to, for example, I had, in the years that I had some involvement, I could hear my colleagues and friends that were from rural and underserved areas. And when I say underserved, that doesn't mean, although we do have underserved areas right in the middle of our cities, I'm talking about, areas where there are large developments and there are no doctors, and so they're underserved. And there were a lot of areas where they wanted to have birthings, all right? And they wanted to have a birthing center. And you cannot do that without having the services available in your field of anesthesia.
Absolutely.
So this sort of got caught up in it. Here we are, 2015, a long way from 1997, and all of a sudden we're feeling the impact of having less people certified. Now, I want to underscore again that both in the AA profession and in the PA profession, you are master's certified.
Correct.
Correct. Yeah.
Correct. So what do you think about that, Michael?
Well, I think you bring up a good point, is that these services are needed in rural areas, that decisions of the past may have led to shortages in certain physician services, but we know that the future is going to involve highly trained physicians, nurses, physician extenders like physician assistants and anesthesiologist assistants to make sure that surgical services are available to the patients that need them and to be delivered safely. NSU has great programs on campus that train physician extenders as well as physicians to provide these services. And I think that that's something that we instill in our students. We want to make sure that they understand that the future of medicine is access to all. So we want to make sure that they're prepared to go to these communities and establish their careers and be a part of the solution.
You hit it right on the nose. I was just going to say that's the solution, and you took my words out of my mouth. So, Stephen Andriatis, PAs are very interesting because, most people don't understand that really the PA movement came out of the Vietnam crisis. That's really where it came out of, when there were no doctors available to care for people in MASH units and whatever. It was the so-called medical orderlies and otherwise that became so involved in the care of these people doing everything that the PA profession really, I don't mean to denigrate the pioneers, but really sort of evolved after that period of time. And a lot of schools started to create the PA programs. And at one point in time, they were certificate programs. Then they became baccalaureate programs. And I'm proud to say that we were one of the first 3 schools in the United States to make it master certified, because we feel that the Nova Southeastern University, that the most important thing, and that's our founder, Dr. Morton Terry, always said, that we can't be individual professions. We have to be a healthcare team. And then when you look at the Health Professions Division at Nova Southeastern University, you realize that we have 28 different areas of healthcare certification and education where we present these various professional venues and entities. But his desire, and it's continued to be my desire, is that we all work together. And the great thing about your profession is that it has evolved into being the masterful and dutiful certified, now master certified for quite a while, individuals that are providing care alongside our colleagues who are in the medical profession.
It has, and it continues to evolve. And like you'd already mentioned, it started in the military. That sort of evolved the whole concept of a PA. Since then, as you've also mentioned, we went from family practice to being in all the specialties, right? We're in cardiothoracic surgery, we're in orthopedic surgery, dermatology, just about every specialty. And that's really what continues to evolve. And the new thing now is going to be telemedicine. Now telemedicine is coming out, and they're going to utilize PAs in telemedicine throughout the world, throughout the country, throughout the world, and it's really going to continue to evolve our program and PAs in general.
Yeah, there's no question about it. And of course, and I can tell you, I can attest to this, that in both of your specialty areas, PAs, anesthesia assistants, that the desire by the general public to become part of our programs is dramatic. I mean, we get thousands and thousands of applications for our PA programs. I mean, thousands. And I'm sure it's the same with our sister schools. I know, there are many schools around us with our sister schools. Barry's always been very communicative and cooperative with us, and also, you know, FIU and FAU, whatever. The bottom line is that it's very important for the people to realize what an important part you both play in them being cared for as citizens, and to extend your knowledge to make them not only whole but better, so that they can live a more productive life.
Absolutely. It's you bring up a good point. Is the interesting thing about healthcare is that although we are providers, we are also consumers. I myself had surgery recently, and you never really get to appreciate something like you do when you become the recipient, when you become the customer at that point. So we make sure that our students are aware that they need to provide the kind of care for their patients that they would want for themselves or their family members. And I'm sure with the physician assistant program, you're seeing much of that as well, especially as faculty members, we're getting older. So we're consuming more than we were when we were in school.
Yeah, and I think that on the same line, you know, going out there and really treating our patients the way they should be, and they really appreciate us. They appreciate us being there. Without us, the wait is a lot longer to see the doctor, right? So we extend out, and we can help get an earlier appointment. We can help see them earlier. Maybe give them treatment. Maybe they just need a knee injection. We can do that knee injection in the office for them. They don't have to wait a month to see the orthopedic surgeon that has a long list, a waiting list. So we want to provide that service for them and get them access to better health care sooner.
And I want to underscore something I said before, just because there are people that are out there and say, well, wait a minute. You know, he just said something. But again, I want to underscore, folks, that these people work under protocols. PAs definitely work under protocols because you work under the statutory provisions in the state of Florida. You must be working under general supervision of the licensed doctor, correct?
Correct. We're always underneath the supervision of a physician. We can operate within their scope of practice. Obviously, in the operating room, we can't take a patient to surgery on our own. We assist in surgery. In the family medicine or internal medicine office or dermatology office, we extend out and we do see our patients, but the doctor's available. They're there for us to collaborate with if needed, and it's a great relationship.
It is. It's a great relationship for the people that are viewing, because they're the ones that they want wellness. Mm-hmm. They just don't want someone to intervene. And I could tell you very candidly, we just did a show on surgical procedures, and I could tell you that one of the two most questioned topics that come from our viewers, and this show really belongs to them, is they always talk about the operative procedures because they worry about pain, cutting, blood, suffering, and the more secure they are relative to the fact that people who are dealing with them are certified by their educational background. Don't forget, if you have a master's degree in your field, physician assistant, and you have a master's degree in your field of anesthesia assistant, it should be a palliative thing to the viewers that are watching the show.
And you do want to know that when you're a patient undergoing what can be very traumatic, emotional experiences, that you want a highly qualified physician involved. And when you deal with physician extenders, you know that there is going to be physician supervision, there's going to be physician intervention, and moving forward, once you have the access to the physician care, as you mentioned, you know, a lot of people have concerns about surgical care, and this as a patient and as a provider, I understand that you want the talent, and we endeavor to provide the skills and the training for these bright young minds to go out and do spectacular things for their patients. But without compassion, you miss that, because most of the drama in surgery happens when the patient is anesthetized. They're asleep, they're unaware. But what they do remember is all of that anxiety leading up to the procedure. So the surgical team with the physician assistants and the anesthesiologist assistants and the anesthesia team, we certainly make sure that you have compassionate, empathetic providers. I think NSU provides a spectacular place for these young budding clinicians to learn this, because as you mentioned, in the health professions division, they're all working together. So they're all working on the same team, and with the experiences of these interprofessional interactions, they're learning compassion and cultural competence and how important it is to be patient-centric.
Well, I'm glad you mentioned it because, you know, I was just having a conversation yesterday with Dean Elaine Wallace at the College of Osteopathic Medicine, and we were talking about the requirements of actually placing into the pedagogy, into the curriculum, some time to spend about compassion and excellence.
It's definitely something that is difficult to teach, right? It's something that we have life skills that we learn as we go along, and hopefully the people that are coming into these programs and that want to be PAs and doctors and anesthesiology assistants do it for the right reason, right? They do it because they really care and they want to see things get better and do things really well. In our clinical medicine class, one of the courses that we teach, within each part of it, we kind of outline certain areas to try to make you understand maybe the anxiety level of a patient and what they may be feeling if they have to have a surgery and those sort of things, and how to talk to a patient about giving them some information that they may not want to hear. Maybe it's a patient that we just got a scan back and was diagnosed with some sort of metastatic cancer. We have to give that information sometimes, and how to give that information and to try to lower the anxiety level, but really caring for the patient. Hopefully, that's why we're in it and that's why we do it.
As you mentioned earlier, the demand for these professions is very large. They're challenging, they're rewarding. The salaries are actually quite high. Healthcare is a growing sector in our nation's workforce. It's a growing sector in higher education. But as you mentioned about selecting these high quality candidates, your viewers should know that these students are standing among the best in the nation. I actually got an email recently from one of our recent graduates that was at a location out in Texas, and she had a chance to share with me her experience where some of her instructors were quizzing her, educating her, and were so impressed with her knowledge base. They said, well, surely you must have gone to an Ivy League school, or did you go here, did you go there? And she said, no, I went to Nova Southeastern University. This is what you should expect. And I think that's important to know, that your providers be well trained, that your providers be compassionate. I think that we're doing an excellent job here. As you mentioned, that cultural competence and emotional competence, these are important words in healthcare education today. And although it's always been our aim, now that we're adding particular elements into curriculum addressing these, we're advancing that further and ensuring that our providers are prepared to meet the challenges of the healthcare environment that they're going to be entering.
Well, there's no question about it. One of the things is that, you know, I've had the privilege of being here now close to 30 years. So I was here at the very beginning before we merged. But I've sat next to two chairs of our Board of Trustees at all of our graduation ceremonies. And both of the chairs have always said something similar to me, and that is, I am totally amazed that the people who are walking across the stage, these were the health professions graduations, that they are going to be employed and they're going to not only help people, but they're going to impact the economy of this great nation. And that's exactly what happens. So we're down to the last minute of this show, and hopefully, folks, that we've presented some knowledge and ideas back to you, or information back to you, to tell you that an anesthesia assistant is someone it's a rather new profession in the state of Florida, not new to the nation, but new to the state of Florida, and that we are doing a magnificent job now, putting 350 plus anesthesia assistant certified, master certified anesthesia assistants out there. And of course our PA programs, 4 of our PA programs, which are outstanding. It's not myself that's saying it, but all of the texts, all of the communications that we get talk about the knowledge and the capabilities and the compassion of our PA graduates, and we're very proud of the 4 programs we have. So thank you, Stephen.
Thank you.
Thank you
for having me.
Stephen Andriatis. Correct.
You got it.
is a great Greek name. I said it before.
Thank you.
And also Michael Stout. Stephen is a clinical director of the physician assistant department, and Michael Stout is a certified anesthesia assistant, and he is a director of the anesthesiology program here at Nova Southeastern University, even though Rob Ragland still thinks he is. But it's only kidding. That's an inside joke, folks. Anyway, the bottom line is that we're very proud of Rob Wagner. He's a wonderful human being and a pioneer that was beyond belief in establishing the program. So we thank him. So thank you very much for tuning in again this week. I hope that we gave you some information that'll be helpful to you, that answers some of the questions that you've had relative to these two professions. And remember, I always say you got to take good care of yourself, but if you're going to see a PA and the PA asks you questions, don't hold back. Tell them what's going on. If the anesthesia assistant comes and says da-da-da-da, other than name, date, and your name, if there's something they're asking you, don't hold it back. Give them the information. It's your life that they're caring for. And I want you to know that this program comes to you from Nova Southeastern University. It's called Dateline Health. My name is Fred Lippman. Until next time, see you.